Healthcare for seniors often involves more than one doctor or specialist. So today we're learning how Innovage PACE in Pueblo brings an entire team together to coordinate personalized care. Joining us is Dr. Veronica Knudsen, Center Medical Director for Primary Care. Good morning.
Good morning.
Welcome back, Doc.
Excellent. Thank you for having me. Good to be here.
So when we say it takes a team approach to senior care, what does that actually look like at Innovage?
So Innovage coordinates care through a team we call the IDT, or the Interdisciplinary Team. It's made up of 11 different specialists that include the registered nurse, the primary care provider, the occupational therapist, the speech therapist, the dietitian, recreation aides, transportation, home care, and we all meet together to ensure that people receive coordinated, high-quality care.
So a lot of these people work together then on one team to help one participant?
Correct. Every participant has members of these teams that know them individually, that know them as a person and know their likes and dislikes.
So then how does this impact kind of the level of care that you're able to give a certain participant?
It's very helpful because a lot of things are complicated in the world. Preventing falls takes a team approach. It's not just a primary care physician ensuring that they have the correct medication. It's ensuring that their home environment is safe. It's ensuring that they have the equipment that they need and that physical therapy has evaluated their gait and walking, that they have safe transportation. There's a lot of coordination to keep people safe at home.
And you mentioned kind of you guys meet all together. So is that something that also helps kind of be able to give them this level of care that you guys are able to do? Because you are talking right then and there with their doctors, with their specialists, with the transportation team. So it makes it kind of all easy because it's all under that one roof.
It is. And so it's so easy because we talk daily. We talk daily with our participants and their families. We talk daily with each other. If concerning things come up, somebody's having some increased memory challenges or changes in their cognition, the whole team approach is very helpful. It also is helpful because people can focus on wellness and on what's important to them. It's not simply management of their chronic diabetes or heart failure. They get to enjoy a team of friendly faces.
Yeah. So what is the difference then between receiving medical care, I guess, from Innovage PACE to maybe a private doctor?
So at Innovage PACE, it's very coordinated. So every participant has a single primary care provider. We have 2 physicians and we have 2 nurse practitioners, and they coordinate care with family members, with outside specialists. So we know every time somebody sees another specialist, it's coordinated through us. We see people every day that the center's open, so Monday through Friday. They can come in. If they're coming and having lunch at the center and they have a headache, they can come and see us that day. They don't have to call and make an appointment.
Oh, that's so lovely.
It is. It's very, very helpful for coordinated care.
Especially because I feel like this takes probably a lot of the stress off of family members who might be a little worried about their elderly family member or friend or something like that who is part of this program. Is that something that you're seeing often?
It is, and it's really beneficial because some of our participants that we take care of really do need someone to be with them a lot of the time, assistance with walking or while they're in the center. And this is helpful because we have people that are there all the time and that know them personally, know them individually. The transportation driver notices if someone forgot their glasses that day.
Wow, so these are these like personal bonds that you're really making with these patients.
Which I think is really the true magic, is having the members of the IDT know people individually.
And it's kind of cool too, because then you get to build those relationships and kind of get to know the person. So if something is off, you see it because you've been working with that client for so long.
Exactly.
And if people want to get interested, they want to learn more about Innovage PACE, they want to get their family members or their friends maybe into the program, how easy is it for people to get involved?
It's very easy. So just reaching out, contacting us at Innovage PACE is the best way. And welcome to come and tour, see what we do. We love to have visitors.
Oh yes, absolutely. Well, Doc, thank you so much for being here, sharing a little bit more about the IDT team and what you guys do here.
Excellent. Thank you so much.
Okay, the Innovage team, like Dr. Rana told us, is happy to help you evaluate your options, see if you're eligible for the program, and share more on how PACE can fit your particular health care needs. To learn more, reach out to Innovage's Pueblo Center staff. They are happy to give you and your loved ones a tour. You can also visit innovage.com for more information. Special thank you to the Innovage team for making this segment possible.